We will have time now before the tea break to hear the keynote address from Professor Isaac Kibwage, Vice-Chancellor, Egerton University, on the topic, the evolution of pharmacy education in Kenya. And I think Professor Huantai has ably acknowledged Professor Kibwage for being physically here, all the way from Joro. We appreciate. I think he represents what a pharmacist should be, from being a student to being a dean in the same school of pharmacy, to being a principal in the College of Health Sciences, and now being Vice-Chancellor. I think he set the bar. And I want us to put our hearts together to welcome Professor Kibwage. Those of us in the house, it's okay to stretch. Give him a standing ovation. It's good. It's good. Thank you. Thank you, Prof.
Let me start by thanking the organizers of this meeting for inviting me. 50 years, it reminded me that that's the definition of two eras in history. To celebrate with you, not as the Vice-Chancellor of another university, but actually as a pharmacist. That's why when Dr. Mwangi called me that he would like me to talk about pharmacy education, I said I'll definitely find myself there. If nothing else, to see some of my classmates. So thank you, ladies and gentlemen, those who are here and those who are in city diaspora or online. You know, online means also those who are in the diaspora. When I was told to talk about evolution of pharmacy training, I just looked at it as really a reflection. I was wondering, what is it that I can talk about that you don't know? Most of you know about the evolution of pharmacy education. So as I stand here, I feel very honored to deliver this, what you are calling keynote address, to you, esteemed colleagues, invited guests, ladies and gentlemen. Let me take this opportunity to acknowledge, can I say, my classmates. If you are my classmates, okay, my sitting classmates. Because some of you were also my classmates, only I was standing and you are seated. But those who are with me seated, Ogaja, don't be shy. I said you stand. Gikunda, only three. Thank you very much. So this, for me, these are very special ladies. We sweat through difficult years at the university. But before us, we had whom I normally call the guinea pigs for the provision or the training of farmers. The class of Wantai, Professor Kugwaro, Annie Ndalo. Maybe you also stand so I don't miss Deborah Kioi. Thank you very much. Maybe, there's a group of, can I call them a group of my students who are very dear to me, who sat when I was standing in class, and they are now professors and the lecturers at the university. You stand unless you are sure that you don't know how you ended up being one. Thank you. So I can always relate to quite a number of you. But when we look back, there are those who really molded us. And this is important because some of the younger pharmacists really don't know about how this pharmacy started. There is the class of 78 who were admitted in 1974. That's the first class. Then our class was the second one, which we were admitted in 1975. There are those founding fathers really who set the theme. There is Professor Maitai, Professor Charis Karemi Maitai. I don't know whether he's invited to come and share with us his experience. The late Professor Gichuru Murioki, Professor Kuria, Professor Kamau. Then there are doctors Karanja, Gatuma, and the late Ogeto, and the late Kofi Sepo. These are the people really who took us through the professional part in the first years. No, in the third and fourth years. Those of you who were in class with me, you know we had many other academicians, both at Chiromo and here on this campus, who took us through the foundational sciences and other areas that grounded us more in our profession. I always remember the late Professor Maina, who taught us about chemistry. He made me like biochemistry. You remember the Satorelli, we used to call him the jailer because he always had such a big bunch of keys. I don't know whether his house had so many rooms or I could open all the rooms in Chiromo. Then there is somebody who was teaching us from Makoginos. I just can't remember the gentleman. Those of you who are with me, do you remember the guy who was from somewhere in Europe, but teaching us from Makoginos? He always stands in my mind because they differed with our classmate, the late Kerowoi, on a project. Kerowoi wrote, he corrected, then he wrote again, and he corrected. Kerowoi was so annoyed, he took it back the same without making any corrections. So he stands in my mind all this time. Ladies and gentlemen, let us look at how has pharmacy evolved in our country. If we look at the historical aspects. We go back to the foundations of the training of pharmacy in our country, and we trace it back to the mid last century, when they started training at certificate level for purposes of dispensing, mainly in the public health facilities. And these continued to evolve. And right now, we have it as training of pharmaceutical technologies, mainly domiciled at the Kenya Medical Training Colleges. These were cadres primarily trained to provide compounding and dispensing in the public health facilities. And they continue to be trained up to this age. Not only are they continued to be trained, but they introduced an element of specialization. So there are technologists who are also doing what? Specializing. But for us, what's important is the landmark introduction of the Bachelor of Pharmacy degree at the University of Nairobi in 1974. You know, that really marked an era in pharmacy education. And it is because of that we are here celebrating. Before this was launched at the university, we used to have pharmacists trained outside the country, mainly in Britain or in India, and they were in small numbers. The chair of the Pharmacy and the Poisons Board is here, and they can attest to it from records. I didn't want to go into the quantitative aspects of the evolution of training. I just said I'll deal with the qualitative aspect. So you don't start writing numbers to see whether you can remember, but you listen to the story as I reflect on my part. So the class of, can I say the class of our chair of alumni, Professor Gwantai, they were admitted 30 students. One of the old guinea pigs, the one walking in, Charles Bosira, Kerongo. Yeah? I'm also trying to see whether my memory is still doing what? Working very well. I got the name correctly. Thank you, Daktari. That class then was followed with hours of 1975, where we were 32 admitted. I really couldn't remember how many of us finished transition in the timely manner. I think we were 24 or something like that. You know, we had very hostile courses, mathematics, chemistry, a lot of chemistry. Those of you remember. Anyway, from those numbers of the 30s to the current ones, where we are admitting around 150 at a go. That is quite an expansion. And they don't look at the issue of just 50 years. It is the facilities as well. I was just looking at the curriculum of the B-Farm program. You remember those of you remember that this curriculum was indeed very comprehensive. It detailed us to know clearly about prescription, processing, pharmaceutical manufacturing, basic and applied pharmaceutical sciences. And those of you remember, we did not really train for interacting much with patients, other than when you deal with the prescription processing and as you continued to give instructions on the usage of the drugs you dispensed. But since then, it has evolved as we look at the advancement of the profession and the training in other countries. So in the 1980s, late 80s and early 90s, we started the drumming that we need to introduce more and more clinical aspects into the BPharm, and indeed that was taken on board, and their adoption of problem-based learning with a very intensive focus on patient-centered care. And well, I've been more out of looking at pharmacy curricula, but I think that is really what is obtaining in the country. Professions grow and the new demands come in, so that we must address those new demands, new expectations. And we started having the demand, having gone out, studied, and came back, that we must have what? Specializations. So progressively at the University of Nairobi, we embraced specializations and pioneered those specializations. Let me just go through a number of them. The first one was in 1997, when we first introduced the first one, which was Master of Pharmacy in Pharmaceutical Analysis. Its impact was profound, both within the faculty then and in the pharmaceutical industry. Because we were now able to train people to go and support the industry, especially in the issues of quality control. We also reformed a unit called Drug Analysis and Research Unit, which was also supporting the local industry, as well as the regulator, the Pharmacy and the Poisons Board, on issues of quality of drugs that were circulating in our market. I'm informed that Daru is still functioning very well, and is always being used as an example of what we call the income generating units at the University of Nairobi. So when you are out there, what are you saying? That the pharmacists could actually think of something that is indeed able to survive. In 2005, those of you who are in the faculty, there was this clamor that we do clinical pharmacy at master's level, Master of Pharmacy in Clinical Pharmacy. This was a serious challenge those of you who are in the faculty, you know, that we had very dynamic, I call them a dynamic duo in terms of thinking, in terms of throwing ideas about. But that time I was the dean, so we pushed this through and I got it approved. When we were admitting students, that dynamic duo left. And I was left scrambling. I remember I had to go and sit with Professor Mago and the team to allow us to import a lecturer. I don't even remember his name. Scott, somebody Scott, to come and help us implement clinical pharmacy. And now clinical pharmacy really has been a game changer in the practice, because these are people who are being prepared for constant interaction with the patients, not just at the dispensing, but at the bedside delivery of services. In 2007, we introduced pharmacognosy and complementary medicine. You know, there's a lot of study on the plants that has gone on in the School of Pharmacy over the years. And this was really pioneered by the late Professor Mwangi, who was my classmate and a friend since we were first years at the university. And the thrust was that we bring complementary medicine to the level where it was in our society. Because sometimes by the time people come to hospital to check on what is going on, they have already done what? Tried some complementary. Either you are chewing some plant that it might work, you are doing something. So I trust that the study of medicinal plants is still ongoing. In 2012, I know we introduced two programs. One was Masters in Industrial Pharmacy. Now, this was geared really to look at pharmaceutics in the pharmaceutical plant. I suppose it's still active. I know that one of the graduates was Dr. Roger Satebe. You know, that time I was so busy, so I didn't track it down, but it is going on. That same year, we also introduced pharmacoepidemiology and pharmacovigilance. I have seen people who have gone through that program, and indeed, it makes a difference in the monitoring drug use and the extent of drug usages. I don't want to pretend that I know the details of it, but there are those who know and can always share with you. In 2013, we introduced molecular pharmacology. Molecular pharmacology, you know, is different from clinical pharmacology. So I suppose we have graduates also of molecular pharmacology. So here we are coming from the bachelor's, the specialization. I don't want to tell you that there are also opportunities for people to do PhDs. You know, when you do PhD, you don't do a PhD in this specialization. You pick a part of that specialization to do a PhD topic on it. That's why PhDs are really specializations, academic specializations, not professional practices. But we also know there are other specialization out there that needs to be looked at and be implemented at the School of Pharmacy. I keep hearing these days about pharmacoeconomics. There is regulatory affairs. Well, there are many others that are open, and we should avail them for our colleagues. When you do your master's, is what we call, you have a leg up so that it is easy to pull the other leg and you move into a different level. So please don't stop there. Let us continue evolving the training of professionals. We also cannot just talk about expanding or growing or evolving pharmacy education only in the University of Nairobi. You know that beyond the University of Nairobi, we have other institutions offering pharmacy training. Among the public universities, you know, we have Kenyatta University, we have Keynote, we have Maseno University. Then we have the latest entrant, I think, is Kisii University, which started 2-3 years back. They have not yet graduated the first cohort. But you also do remember that there are people who are also starting clinical pharmacy in Moi University. I don't know whether it got traction or it fizzled out. Then we also have private universities which are running bachelor's programs. You remember Mount Kenya University, which did a lot of upgrading of technologists to degree level. The United States International University. You know, this is the university where I started BPharm with, I think, only 6 candidates admitted. I think in 2015, but it has grown. And it has been nurtured also by our own colleague, the Professor Ndemo, who was on leave of absence, went there to help them as a dean. And I also found out that the current dean is Professor Stadmar from the Faculty of Pharmacy, out of the School of Pharmacy. There's a Kenya Methodist University in Meru. They are also offering a BPharm, and I think this was championed by the late Professor Bega. We have Kabarak University. Kabarak is, of course, now where Dr. Gaja is domiciled. And well, next close to where I am, you know me, I'm in the agricultural university, where I tell people they needed a pharmacist to come in and to give you a dose of medicine. And what they do is really One Health. You know One Health? Yes. And I keep telling them here we train people on making the most critical drug for a human, and that is food. People never, do you ever think about food when you are eating, that it is a drug? You don't. But how many days will you go without eating it before you start suffering the consequences? Now, so pharmacy has outgrown the University of what? Of Nairobi. It has actually spread. The chair of the BBB is here. Maybe he knows some I have left. I think now we have extensive people offering the diplomas and these degrees. So I can imagine in the new graduates joining the market on a yearly basis must be in thousands. Not when we were just 30 to 50, is in thousands. What does it also say? Think about it, whether you want to join the run of the mill or you want to be an exceptional and move up. I want to reflect on the enablers and the challenges in pharmacy education. And you know, this cross-cuts both public and private. The critical one is the investment in qualified academic and technical staff. I'm not sure about University of Nairobi, but all public universities, we have serious financial constraints. I don't know whether you have. Now, you know, I can't ask. I don't know who now heads pharmacy here. You know, when I left, I knew the dean is in charge of the school. Now, Dr. Wante, who was blessed with being a professor, you will be a professor soon. And Abuga, who's not here. I know we have lost some of our senior lecturers, but have you replaced them? No. I know here in the medicine, they have also lost a lot of staff, and there is no replacement. You know, this is literally all over the place because of financial constraints. And you know, when you lose those people, especially those who are making transitions to the hereafter, what are we having? We are having shortage of staff. Are we producing enough to replace? Because people will be looking towards the School of Pharmacy in the University of Nairobi to give them well-trained staff for academic purposes. I don't know whether they are there, but I also do know that quite a number of the academic staff in the School of Pharmacy are the BC moonlighting out there, training in the private universities. So if we don't have staff at the University of Nairobi, what about out there? Then they must be suffering. If you are teaching too many hours in the University of Nairobi, you are exhausted, so you cannot go to do what? To support those ones. So this is a serious problem that needs to be addressed. And we have the knowledge to participate in that creation of new academic staff. There's expansion of physical infrastructure. I don't know how many of the young fellows know that, you know, the building next to the pharmacy there, which houses the post office, it used to be a mortuary. And Professor Kugwaro, did you ever use it? But I know we used it as a lecture class under the year binders. I know that we actually added the gun is for carrying cadavers. They were there in a room, and with us, we are using the other room. And during that time, pharmacists never used to do what? Anatomy. But I didn't find anybody in our group who was afraid. But when we look back, those are 50 years. And we haven't really had significant improvement in physical facilities. I've never gone to check on physical facilities in other universities, but I suppose the challenges are there in all those places. And we need to expand them because there's more and more demand for pharmacy training. The third one I want to talk about is provision of modern training facilities. You have the physical facilities, but you also need what? Training facility, audiovisual, skills labs, on which then students are able to practice before they leave the institution. Quality control labs, where those wanting to go to the industry can see how drugs are being analyzed. Then we are also saying we position ourselves because we are in the global market. The training at the University of Nairobi, I call it world class because anytime I talk to pharmacists who go to the US, like to Britain, they don't have issues passing those exams and getting admitted to practice in those countries. Really, that tells you something. Because when we get some from some countries here, they keep failing. But ours go out there and they pass. That's a testament to the quality of pharmacy training that we offer at University of Nairobi. And we need to continue and improve on it because some of those countries now, for you to enter into practice, they are demanding, can I say they have raised the bar? You need to enter at master's or a PharmD level like in the US. So we should also be strategically looking at our curricula. We need to reposition, to repurpose it so that we remain relevant. And that's a challenge to the alumni who are in academia. So just to make my closing reflections, I said I'm reflecting on this pharmacy training journey. I know I didn't want to say that there are also other openings to be politician. Dr. Nyarita is here. She says that she's not a politician. She's in the county government. One of our own alumni, Dr. Kidero, who was the first governor of Nairobi County. I know there are many pharmacists who are CECs, Nyarita being one. Yeah, there is Mwaniki there, the former president of PSK, who wanted to be, was it an MCA? But what I'm saying is that we really have all kinds of what? Opportunities. But let us mold those who go through our hands and those we fraternize with, that they develop the character of honesty and integrity, so that when they are in those positions, they are also a reflection of our profession. So when I make the closing remarks, I'm just thinking about the journey from the basic certificate training to a multidisciplinary, globally relevant professional training has been both transformative and inciting or inspiring. As we mark these 50 years of pharmacy education at UoN, we should also, or we must also celebrate the broader growth of the profession and the impact across the country. Let us now look at a future where pharmacy education continues to be specialized, research-driven, patient-centered, and aligned with the global best practices. With that, I wish to thank you, ladies and gentlemen, for your patience and attention. Be blessed.
Thank you very much. Very well captured journey of pharmacy training. And I think also a challenge as to where we should be going. I know we'll have the closing keynote address by Professor Gabriel Keegan from Moi University, who was my classmate. Yes, he will be coming to tell us the future. Thank you very much, Prof, for that reflection. I think we have learned a lot, and those who are online, you have also been updated as to what is actually available. If you did a bachelor's, you have a wide range of training that you can pursue right here at the School of Pharmacy. And also the expansion has also been to other schools in other universities. And as Professor has mentioned, many of those universities have enjoyed the drive by the graduates of the University of Nairobi. And therefore, as we talk about impact, the impact that those universities are making in health, in pharmacy, can be traced back to the school.